Hi, I'm Ashley Megalin. I am a technical consultant for the Alabama County Health Department Laboratory System. In this video, we will demonstrate how to take a sample for the Syphilis Health Check test. The Syphilis Health Check method is CLIA waived, which means that no competency is required of testers. But this method is only CLIA waived if the sample used is taken from a capillary finger stick, whole blood. Before we get started, we're going to need to make sure that we have all of the equipment that we're going to need to perform the finger stick and the sample collection. We're going to need gloves, and here we have a pair of nitrile and a pair of latex, depending on if your patient is allergic. We have alcohol wipes. We have medium flow lancets. We have gauze pads. We have our MicroSafe tube, and this comes out of the kit that came with the Syphilis Health Check with the cassettes. We have Band-Aids, and then we also have our sharps container. We need to confirm the identity of our patient. So can you tell me your name and your date of birth?
Carrie Johnson, February 15th, 1985.
Great, thank you. Anytime there's a chance that we could come into contact with bodily fluids, we need to observe universal precautions. So today we're going to be wearing gloves, but I need to check with my patient to see if she has an allergy to latex. Are you aware that if you have a sensitivity to latex?
I do.
Okay, so today I'm going to use nitrile gloves. And now we're going to prick her finger. We're going to choose a non-dominant finger from our patient, either the middle or the ring finger, because that will be more comfortable. We're going to avoid very cold, cyanotic, which means blue, swollen, or inflamed fingers. When we take our sample, we're going to want to take the sample from the outer edges of the pad, but we're not going to take our sample from the very center of the pad. And we're also not going to take a sample from the side of the finger close to the fingernail because the skin is thinner there and there is less blood flow. We may have to help our patient warm their hands if necessary, or you can ask your patient to warm their hands through friction. Once you've chosen a finger and ensured that the patient's hand is warm, you will take your alcohol wipe and clean the finger. You want to thoroughly clean the finger. We need to let the alcohol completely dry off the end of her finger. So while the finger dries, I'm going to talk to you about the lancet. The lancet is a small blade, not a needle. So when you activate your lancet, you need to position it across the fingerprint and not parallel to it, so that the blood drop will well up on the finger and not run down the fingerprint ridges. Now that her finger has dried, you will hold the finger at a downward angle and use pressure to push blood toward the tip. Squeeze the finger and maintain pressure as you activate the lancet. You will firmly prick the finger on the side of the pad. Then you will properly dispose of your lancet. Keep firm pressure toward the finger pad and wipe away the first 2 drops of blood with a gauze pad. Do not use an alcohol wipe, as alcohol will affect the test. You must wipe away the first 2 drops to avoid test interference from alcohol. Apply firm pressure again and allow a large drop of blood to form on the surface of the skin. Using the MicroSafe tube from the Syphilis Health Check kit, hold the tube at a horizontal to slightly descending angle and touch the tip of the tube to the blood drop. Capillary action will draw the blood into the tube. If the blood drop is large enough, the blood will stop at the black line. Do not squeeze the bulb to collect the sample. Now I'm going to put pressure onto her finger And I'm going to ask my patient to hold pressure on the sample. Now we have our sample. It has drawn up. There is a bubble in here, but I believe that I can still get 2 drops out of this capillary tube. If you have to use a second blood drop to collect enough blood in the capillary tube, you may collect some air in the capillary tube. If there is too much air in the tube, you must start again with a fresh finger and tube. You must be able to expel 2 drops from the microsafe tube for the syphilis health check test. Once the bleeding has slowed, you're going to want to put a Band-Aid on your patient's finger. Finger stick blood must be used immediately after collection. If you have any questions about the syphilis health check test or how to take a sample by the finger stick method, please contact a technical consultant at Quality Management. Thank you for watching.